name's Colin Campbell. I'm a dentist and a specialist oral surgeon, and I practice and work at the Campbell Clinic and Campbell Academy in Nottingham, which is a facility that we purpose-built and opened in early 2020. We first began to work with Planmeca based on service. I think that's the most important thing. We were looking for someone to partner with in this project, which for us, and I think for most people, was a massive, massive project. And we needed trust and service and quality. From sort of 2018, they were involved in the design process. We travelled to Helsinki to see the company, to see the culture of the company, to meet the people there, to see things being built. And we were like sold on this partnership of working with someone in the long term that we could trust, that we could develop a partnership with. But the thing that first attracted me and drew my attention to Planmeca was the ultra low dose feature in CBCT. Because the way it worked in my mind is that if you could lower the dose of CBCT, you could take more CBCTs for patients and get more diagnostic quality and more diagnostic information. And so if I was able to cut it in half, I could take twice as many, and if I could cut it in half again, I could take 4 for a patient. So I could pre-op a patient, I could post-op a patient if I wanted to, but more importantly, I could reduce the overall dose to my patients, because we have a responsibility to do that. Everybody gets obsessed with clarity of image at any price, and that's not how it works. And then Remexis as a software system, I said I've used pretty much every software system there is, but there isn't one better than Remexis. How intuitive it is, how clear it is, how easy it is to plan cases. If you want to design guides, you can design guides on there. If you want to import other digital media in there, you can, and it's seamless. And so that, combined with the ultra low dose facility and CBCT and its adaptability, it's just an extraordinary product. But some of the things that were clear to us is that we wanted things that looked the way we wanted. You know, they looked amazing, and the chair setup, everybody comments on it because it's minimal, it's not clunky, the lines are beautiful. Patients comment on it, delegates, dentists who come here comment on it, and the knee brake element for me was really important. I don't know why anyone wouldn't have a knee brake chair, because it creates so much room in your surgery, and it's a chair. It's a normal sitting position for a patient when you first want to speak to them and you first want to chat to them. They're sat up with you, their legs aren't flat out, it's more comfortable. And then there's just the whole sort of ergonomics of it. It's designed for working, and so we have the overarm delivery, which is a little bit non-British, I guess, in a lot of ways. I would never return back to a cart system in a million years, and nobody here would. And because of the digital setup on it, it's really easy to control, really easy to program for individual clinicians, program your colour on your chair, but also easy to interchange componentry on that, which is super important, easy to service. We found that, and we've had a lot of support in that regard from Planmeca and the Planmeca engineers. And then the chairs itself, like dead easy to adjust, headrest, everything, lots of adjustment in this, and no armrest. That's a massive feature that people overlook. The way the chairs are designed, you don't need an armrest, and I do a lot of intravenous sedation, and I don't have patients with arms falling off the chairs or moving, because everybody is kind of designed into the centre of the chair. And then the feature that we added, which is an add-on feature, is this. And I can tell you that in our practice, from a patient perspective, that is the biggest feature we've got. I love the lights, they're brilliant. I use all my implant surgery on these lights, they're fantastic. It has a movable spittoon, which I'm sure other systems have too, but that's just brilliant. All my patients are totally frozen up when they're trying to rinse them out. And then the keypad is really simple. It's got a big clock on it, which is fantastic. Another one of the features is the ability to have an inbuilt cleaning system built within the chair, which makes life so much easier, so much better, and so much more compliant for everybody. And so we knew that we needed to be investing in our future, things that would see us into the future, and also a relationship that would see us into the future. And so what you get with Planmeca, and why we continue to work with Planmeca day in, day out, is you get value. And people don't understand what value is. They think value is the cheapest product, and it isn't. So value is getting more than that which you pay for. That's what value is. And that's what you get back in relationship, in support, in collaboration, and in products that are forward-thinking and innovative and always developing. And so, you know, you buy cheap, buy twice. You know, we kind of knew that. And so, and we're 5 years into this now, and we're not going in any other direction. We're continuing to work with Planmeca.